Hi, my name is Andy Peralta and I'm going to talk about Andexanet alpha for the reversal of factor XA inhibitor activity. First, the director of factor XA inhibitors, apixaban, rivaroxaban, and indoxaban, are used in the prevention and treatment of thrombolism. Indications for the use of these agents include the prevention of stroke in patients with non-valvular atrial fibrillation, the treatment and secondary prevention of deep vein thrombosis and pulmonary embolism, and the prevention of venous thrombosis after orthopedic surgery. In spite of the demonstrated safety and efficacy of factor XA inhibitors as well as their practical advantage over vitamin K antagonists such as warfarin, the lack of an specific antidote to reverse their anticoagulant effects is an important limitation. We have here the first video. Now we're going to see.
Coagulation factor 10A plays a pivotal role in the final common pathway of the coagulation cascade. Factor 10A assembles together with factor 5A on the platelet surface, forming the prothrombinase complex, which is responsible for the large-scale conversion of prothrombin to thrombin. Inhibitors of factor 10A work by one of two distinct mechanisms. Small molecule direct factor 10A inhibitors, such as apixaban or rivaroxaban, bind to the active site of factor 10A and neutralize the catalytic activity of the prothrombinase complex. Indirect factor 10A inhibitors, such as enoxaparin or fondaparinux, bind to native antithrombin 3 and potentiate its capacity to inhibit factor 10A. Andexanet, an investigational drug, is a recombinant factor 10A derivative being developed for use as a universal antidote to direct and indirect factor 10A inhibitors. Andexanet lacks the membrane-binding domain of plasma-derived factor 10 and does not compete against native factor 10A in prothrombinase assembly on the platelet surface. Andexanet also features a serine to alanine substitution in the active site and a deletion of the heavy chain activation peptide that is present in native factor 10. Thus, Andexanet lacks pro- or anticoagulant activity on its own. The mechanism of action of Andexanet is based on its capacity to function as a decoy factor 10A molecule. Andexanet binds to direct factor 10A inhibitors with high affinity, sequestering the inhibitor and thus rapidly reducing the free plasma concentration and neutralizing the anticoagulant effect of the inhibitor. Andexanet also binds to and sequesters molecules of antithrombin 3 that are complexed with indirect inhibitor molecules, disrupting the capacity of antithrombin complex to bind to native factor 10A. Currently, there is no effective antidote for...
Okay, continuing with the presentation. Now, in clinical trials involving patients with atrial fibrillation who were receiving factor XA inhibitors, major bleeding was found to occur at an annualized rate of 2.1 to 3.5%, and clinical experience has been consistent with these results. Anticoagulation-related major bleeding is associated with an increased risk of death and thrombotic events independent of the class of anticoagulant used. Patients who receive factor XA inhibitors may also be at an increased risk of bleeding if emergency surgery is required. With the increasing of factor XA inhibitors, the number of patients who require reversal of the anticoagulant effects is anticipated to rise. Therefore, a specific antidote that can rapidly reverse the anticoagulant effects of factor XA inhibitors in patients who are bleeding or who require emergency surgery is needed. Now we have second video. About the AN and then AX. No. Now continue with the presentation. We have Andexanet alpha. Andexanet is a specific reversal agent that is designed to neutralize the anticoagulant effects of both the direct and indirect factor of XA inhibitors. Andexanet is a recombinant modified human factor XA, the core protein that is categorically inactive but that retains the ability to bind factor XA inhibitors in the active site with high affinity and 1.1 stoichiometric radio. Andexanet binds and sequesters factor XA inhibitors within the vascular space, thereby restoring the activity of endogenous factor XA and reducing levels of anticoagulant activity, has associated by measurement of thrombin generation and anti-factor XA activity, the latter of which is a direct measure of the anticoagulant activity. We have now another video right here.
Factor Xa inhibitors, such as apixaban and rivaroxaban, are convenient to take but can cause bleeding complications. Many physicians hesitate to use them because there's no easy way to reverse the effects of treatment in the event of an accident, internal bleeding, or surgical emergency. Andexanet is a fragment of factor Xa that was designed to rapidly reverse the anticoagulant effects of these inhibitors by preventing their binding to authentic factor Xa. To test the efficacy of Andexanet, a small phase 3 trial was designed with healthy older volunteers as the participants. They were given either 10 milligrams of apixaban or 20 milligrams of rivaroxaban daily until steady-state anticoagulation had been achieved. Then intravenous Andexanet was given to determine whether the effects of these anticoagulants on blood clotting could be reversed, and if so, what the side effects might be. The primary outcome was the mean percent change in anti-factor Xa activity, which was significantly reduced both in participants who received a bolus of Andexanet and in those who received a bolus followed by an infusion of the drug. Participants who received a bolus of Andexanet had fully restored thrombin generation within 2 to 5 minutes. And this effect was sustained while Andexanet was given as an infusion after the bolus. No serious adverse events were.
Okay, now continuing. We have, in conclusion, Andexanet is a specific rapidly acting antidote that is being developed for urgent reversal of factor XA inhibitor anticoagulant activity. In our studies, Andexanet rapidly restore factor XA activity and thrombin generation and reduce unbound factor XA inhibitor concentrations in apixaban treated and rivaroxaban treated older patients. The reversal of anticoagulation with Andexanet was not associated with safety concerns or thrombotic events. The ability of Andexanet to reverse anticoagulation markers in participants undergoing anticoagulation with apixaban, rivaroxaban, edoxaban, or enoxaparin makes it a potential universal antidote for both direct and indirect factors of XA inhibitors. The rapid onset and offset of action of Andexanet and the ability to administer it has a bolus or has a bolus plus an infusion may provide flexibility with regard to the resolution of hemostasis when urgent factor XA inhibitor reversal is required. The ongoing Annexa-4 phase 3b4 study is evaluating the efficacy and safety of Andexanet in patients with factor XA inhibitor associated with acute major bleeding. And we have now the last video.
Coverage continues at the 2015 ISTH conference in Toronto. I'm Thomas Baldrick, joined now by Polly Pine. She is the Senior Director of Pharmacology at Portola Pharmaceuticals. Thanks for coming by and spending some time with us.
Thank you, Tom, for inviting me.
What can you tell us about this research?
Okay, so we have been testing Andexanet alpha and the four-factor prothrombin complex concentrates in an animal model. These animals were anticoagulated with rivaroxaban.
Okay, thanks for watching and have a nice day. Bye.